decisions they do make. Roles and responsibilities of the EMT. It's just not going out and treating the patient. It's your responsibility to keep your vehicle and equipment ready for any emergency. Whether you come in at 6 o'clock in the morning and check your truck off, make sure that all the equipment is on there, to making sure there's fuel on the truck, the tires are in good shape, there's no garbage laying around, there's a pillow and a blanket for the patient. Just always making sure your vehicle and all your equipment is ready for any emergency coming in. It's your responsibility to ensure safety for yourself, your partner, your patient, and any bystanders that show up on the scene. You're responsible for operating an emergency vehicle in a safe manner. And sometimes it's going to be one of your roles is going to be an on-scene leader. Whether you want to or not, you may be on a scene and actually be the one that's in command of that scene, because there's no one of higher training or a higher level of authority there at that time. You're expected to perform an evaluation on the scene. You're calling for any additional resources that you think you need. You're responsible for gaining patient access, and you're responsible for performing a patient assessment. Patient assessment is done on every patient you see, whether it's going from the nursing home to the doctor, hospital back to the house, or a car wreck, a chest pain, a stroke victim. Whatever it is, you need to perform a patient assessment on every one. It's your responsibility to give emergency medical care to the patient while awaiting arrival of additional medical resources. You're responsible to make sure you only move patients when absolutely necessary to preserve life. And sometimes you may have to give emotional support to the patient, to family, and to other responders. You're responsible for maintaining continuity of care by working with other medical professionals to resolve emergency incidents. You're responsible to uphold medical and legal standards and to ensure and protect privacy. You're responsible to give administrative support, to constantly continue professional development, whether it be taking classes, practice skill stations, practicing, reading up on articles, anything you can to continue your professional development to be a better EMT, to cultivate and sustain community relations, and to get back to the profession. One day, this may be some of you all sitting here narrating these PowerPoints like we are and teaching on up and coming EMT students.